Welcome to Cravings Control for Fat Loss. I'm your host, Laura Cavallo, former sugar binger, overeater, and yo-yo dieter turned fat loss and cravings coach for hundreds of busy women. Here at Cravings Control for Fat Loss, I'll be sharing mindset, movement, and metabolism strategies for those who are ready to ditch the fat diet cycle and slim down without counting calories, tracking points, or giving up any of the foods they love. Get ready to embrace progress over perfection, grace over guilt, and bring curiosity and learning to the inevitable ups and downs of your life. Expect a decrease in your cravings while seeing and feeling an improvement in how you look, how you feel, and your overall quality of life. I am so excited you're here, boo. Let's get started. On today's episode, I welcome back naturopathic doctor Laura Gouge, and we discuss ADHD. From diagnosis to treatment outside of medication, and what you can do in the way of lifestyle, diet, and exercise to help manage your symptoms better. Laura shares her personal ADHD journey and the quirky things she experienced growing up as a result of her mom also having ADHD. We also discuss her 8-year history treating patients with ADHD and the often overlooked positive attributes of having ADHD. I love chatting with Dr. Laura. Her approachability, knowledge, and warm personality make having her on the podcast a real treat for me, and I know it will be for you as well. Please give this a listen and then let us know what you thought, if this was helpful, or if you'd like for us to dive deeper into any particular topics surrounding ADHD. Hey there, boo! I am so excited to announce that another round of the Cravings Code will open for enrollment this September. If you haven't heard, the Cravings Code is for women who struggle with overeating, constant cravings, and insatiable hunger, and are ready to get them under control while shifting their all-or-nothing thinking around diet, around exercise, and their health. What you can expect is up to a 70% decrease in your cravings, in your hunger, and your overeating, and prime yourself to naturally eat fewer calories and sustainably lose weight if that's one of your goals. The best part of all this, there's absolutely no eliminating your fun foods, there's going to be no fad dieting, and there are no gimmicks. As a result of the strategies and tools I'm going to teach you, you're going to see your guilt, your shame, and the stress around food slowly fade away. I guarantee it. If this sounds like something you need and are interested in, go below and add your name to the waitlist. By adding your name, there is absolutely no commitment to join, but you do get an option to enroll early at a majorly discounted rate. More details coming in August, and I'll see you there. Welcome to another episode of Cravings Control for Fat Loss. My name is Laura Cavallo, your cravings coach, and today we have a return guest who I am so excited to chat with. We have Dr. Laura Gouge on the podcast. Welcome, Laura.
Thank you so much for having me again. It's great to be back.
You're welcome. I have been loving your content, and I was just telling you before we hit record that watching your content over the last 6 to 8 months, focusing on ADHD and diagnosis, treatment, lifestyle specific strategies that people can take, and also how it can really impact cravings, hunger, and overeating. I was like, our people need to hear this. Our people need to know that there's things that they can do and there's reasons behind, you know, the connection between ADHD and cravings and impulse and things like that. So I'm super excited to pick your brain today. And, you know, my brother grew up with ADHD. He was diagnosed as a kid. He was taking Adderall from the get-go. And I think that's really all I know about it. And except for a lot of my clients are now coming in and saying that they're being diagnosed as adults. I know that you have ADHD and you have your own ADHD journey. Were you diagnosed as an adult or when you were younger? Tell us about that.
I was diagnosed as an adult. I was 31. And looking back, I grew up in a household where my mom has had ADHD. And I think in many ways, there were so many sort of quirky or bizarre things about our household because of that I did not see it in myself. I mean, even though I went to medical school, I still feel like when I learned about ADHD, I really saw it as this very specific disorder that manifested in very specific ways. And I did not see it in myself. I didn't identify with it. And in a way, it's like when you're so close to something, you often have blind spots. And then especially depending on the household you grew up in, there's things in the household that may seem normal that aren't. And it wasn't until I was 31, I actually had an ex-boyfriend who is a psychologist, and I'm very grateful for this conversation. But I was telling him just some of the quirky things about my childhood, like little things like my mom would forget to pick me up from school, or we would eat dinner at 9 o'clock at night. I didn't have a bedtime. And I'm not in any way saying anything negative about my mom. It just was, there was very little structure. It was very easy for her to be forgetful. And in this conversation, my ex said, have you ever thought maybe your mom had ADHD? And just this total light bulb went off. And then of course, because there are genetic components, I started looking at myself and then sought out a person to evaluate me. And it was, when I took the test, it was pretty undeniable that I would meet criteria for it. I just, it really challenged all the like notions I had of like how I thought it would present. Right. And how, especially in women, we can often have a unique presentation.
Wow. And so tell me what your initial notions were around ADHD and what your markers were for it.
So I really thought of ADHD the way a lot of people probably think of it, which is I thought back to the kids that I went to elementary and middle school with, and it was usually a male student in the class who would be really disruptive, who would be running around, throwing himself on the floor, being really talkative, really disruptive. That's what I thought of as ADHD. And I think so many people have that idea. And it sort of makes sense because if you look in the DSM, which is from the American Psychiatric Association, looking at diagnostic criteria, the criteria doesn't feel tangible. It sounds like they use sort of like big words that feel hard to connect with. And so when you read things like difficulty initiating tasks, while I had a tremendous tendency to procrastinate, I didn't connect with that language. I didn't think of it that way. And I think for a lot of women, and I'm in this category, when you're more inattentive, it's really missed because I just sat there very quietly in school. And I remember I had just assumed I had a learning disability and I just kept it to myself. And my learning disability was that I couldn't hear what the teacher was saying. I would just sit there and smiling with just full of anxiety that like my math teacher might ask me to come do a problem on the board, because I could go home and I could learn the material and I could do it and I could get basically straight A's in school. But when I was sitting in class, I would be so bored, I couldn't track what the teacher was saying. And this is a really common symptom of being inattentive. Of just, if it didn't interest me, it was really hard for me to pay attention.
Wow.
And so I just found these workarounds, and in a way, like, thank goodness that I did. And I think a lot of people do this where they just make assumptions about why things might be hard for them. And then they internalize them. A lot of women end up having a lot of depression and anxiety and feeling just shame about these symptoms, and then finding ways to try to hide them from the world.
Right. And you went on to become a doctor. So look at that. Wow. You said that characteristics present differently for men and women. Can you share a little bit about that? Obviously, we heard inattentiveness and maybe aloofness. I don't know if that would equate at all. I know my brother fits exactly what you said, like running around, high energy, disruptive, like that. That was him for sure, in a good way. Love you, brother. But yeah, tell us a little bit more about those differentiating characteristics.
So the main kind of categories of symptoms for ADHD would be inattention or difficulty paying attention, hyperactivity, which can manifest in a lot of different ways, but in some ways it's being active. For a lot of women, for example, we may manifest hyperactivity as having racing thoughts, where it feels very, very hard to slow down our thoughts. It could also show up as feeling like it's really hard to sit still in a boring meeting, where there's a sensation kind of like you're crawling out of your skin or you need to fidget, but it may not manifest as being loud or disruptive or, overtly hyperactive. And then another main symptom pillar is impulsiveness.
Okay.
And so a lot of times we can see these symptoms really clearly in children because they just don't necessarily have the ability to mask. And
Right.
so they, show up and you can just see when they're not paying attention. You can see their hyperactivity. You can see the impulsiveness because they're interrupting you. And it can be normal developmentally, like for littler children, especially. Like it's normal for them to interrupt. It's normal for them to just be moving and to not necessarily pay attention to certain things. But as they get older, you can see it more clearly. And then in adults, we can manifest these symptoms in different ways because a lot of times we learn coping skills and strategies. So impulsiveness could show up as struggling with overeating. It could show up as feeling impulsive around substances like cannabis or alcohol or other drugs. It also could just show up as texting someone, maybe in a dating situation where you text them and you're like, oh, that was a bad call, but like doing things really quickly, really impulsively. And sometimes we don't even recognize it as part of ADHD. We think it's just our personality.
So as you're saying that, I'm like, okay, do I have ADHD now? And so I guess, how does one go about getting diagnosed as having ADHD? Because a lot of what the characteristics you're sharing, people could have independently, right? Some people could be more impulsive, but maybe not have racing thoughts, right? Or maybe people could have racing thoughts and feel like they can't sit still, but they are calmer, right? So how does one go about getting diagnosed as having ADHD?
So definitely a caveat that when you hear things like this, it is very normal to see yourself in it. It's sort of like reading horoscopes where most symptoms of ADHD, most of us have some of the time. And a big qualifying part of the criteria is it negatively impacting your life in more than one area, right? Is it showing up to the degree that it's problematic? Because it's a spectrum of symptoms. And so there's many people who have symptoms of ADHD, but they're not going to meet diagnostic criteria. But to answer your question, I would look into meeting either with a psychologist or a psychiatrist and finding somewhere that they do ADHD assessments. And there are what are called clinical assessments, which is what the average just doctor or psychiatrist, nurse practitioner is going to offer. And then there are places where they do more specialized testing, where they're going to put you through actual tests to look at your ability to focus and stay on task, potentially doing really detailed questionnaires, interviewing other people in your life. So a lot of times it just depends on how old you are. It's often easier to get assessments covered by insurance for children. But even as adults, it just depends on cost, accessibility in the state or city that you live in. I know in different areas, when I was practicing full-time in Oregon, there were often really long wait lists for people to get assessed. And so we would do what was called a clinical assessment. I would potentially start someone even on treatment, and then we would get them in for the full assessment when someone became available.
Wow. Okay. Thanks for sharing that. And I think that could be helpful for some people who maybe heard you share some of those characteristics and are like, oh, wow, okay, maybe it is negatively impacting my life, and I do see some of those characteristics, but of course, wanting to go get officially diagnosed and through a professional would be really helpful. So before we dive into we talked about the signs and symptoms and diagnosis, but more about the treatment and getting into the cravings and the overeating. Why don't you tell us a little bit about yourself, your history, how you got into naturopathic medicine, and then sort of your history helping people with ADHD and kind of what you're doing now?
So I am a naturopathic doctor. I have been in practice for a little over 8 years now. And when I started my practice, I ended up just getting this cool job for a mental health clinic. And so I wouldn't say that was what I had been seeking out, but it was the thing that found me. And it seemed like I was very compelled. They really wanted a naturopathic doctor. And for anyone who's not familiar, as a naturopathic doctor, I went to naturopathic medical school. And so my training is, for the first 2 years, very comparable to a medical doctor where we study anatomy and physiology and biochemistry. But then in the second half of our education, in addition to learning how to diagnose and how to use pharmaceuticals, we also learn how to use nutrition. How do we use supplements in a safe or effective way? Are there other tools we could use, like potentially herbal medicine or homeopathy, different things like this to really support the body as much as possible as a whole. I think one of the big things that has really been revealed as the conventional medical system is sort of, things are changing in the conventional medical world. But I think one of the biggest things is that the way we've set it up, that we have specialists for each system of the body, but the specialists don't necessarily communicate with one another, that's not effective. We really need to look at the body as a whole. And if someone's having something like anxiety or ADHD symptoms, instead of just sending someone to a psychiatrist, it's worth also looking, are there other things going on? Like, is there a connection with the gut? Is there something going on there? What's happening in the reproductive and endocrine system with our hormones? How is our sleep? How is our stress level? How are sex hormones? Because we know that ADHD symptoms fluctuate tremendously around hormonal changes in life. And this can just look like the 2 weeks before a menstrual cycle. It can look like going through puberty. It can look like when you hit perimenopause or postpartum. But hormones could have a tremendous impact on these symptoms. Looking at allergies and things like this, we know that children who are diagnosed with like the allergic triad of allergies, asthma, and eczema, later on in life, they're 30 to 50% more likely to be diagnosed with ADHD. So what's the connection with histamine? And a lot of this is correlation. Like, it's not saying it's causation, but it's looking at the body as a whole and saying, what's going on with our whole system, with our whole body, and how can we support the body as a whole? Assuming that symptoms are not just this predetermined genetic thing that we can do nothing about. And it doesn't mean there's always a holistic cure for everything, but it's like, how can we support bringing the body into balance as much as possible?
Yeah, I have shared this with you before, but naturopathic practice, right, becoming a doctor was something I was always really interested in, and more so in the last 8 years that I've been in health and fitness because of specifically what you said, understanding that everything is so connected. And I really began to understand that when I started taking a closer look at my hormones and getting off birth control. And I read this book called Woman Code by Alyssa Vitti. And it just informed me about how much our hormones affect everything from your digestion to the pimples on your skin, to your mood, to your sex drive, to your cravings and your hunger. And I was so blown away that these things that you don't see, right? I was kind of oblivious to, could have such a big impact on cravings and hunger. And so then I started studying sleep and started studying stress, two of the things that you brought up, and how vitally critical they were to cravings, to hunger, to overeating, and to your mindset around your relationship with food and your relationship with your body. And so I really value your approach, and it's very much how I like to coach my clients, right? And the elements that I like to bring in. So I'm really excited to dive more deep into this. And so you started working with ADHD patients how long ago, and what brought you to this point now?
I started working with people with ADHD, about 8 years ago. So I was the medical director for a mental health clinic outside of Portland, Oregon, and probably about 50% of my patients had ADHD. And as I was working with that patient population, what I was really finding was there were a certain number of people who were coming in and they'd already had horrible responses to stimulants. This isn't necessarily common. Most people tolerate them okay. But there's some people where they get incredibly anxious, depressed, total insomnia, extreme anger or agitation. Or a lot of people just say, I don't feel right. Like, I don't feel like myself on the medication. I don't like who I am. Now, this isn't everybody, but it's just some people. Then there would also be people who maybe tolerated medication okay, but there was a problem, like they had a really bad side effect to it, or the medication seemed to work, but it would only work for a few hours. Like the manufacturer might say, oh, this will be effective for 8 to 12 hours, but it's actually very individual how we metabolize medication. And I also quickly learned that just because you have medication in your system, it doesn't necessarily tell you what to focus on. So someone comes in and says, oh, I have this horrible problem procrastinating. I can't figure it out. Well, you can take a stimulant and might help you not procrastinate, Or if you choose to look at YouTube, you could spend the next 6 hours deep diving into a conspiracy theory on YouTube. Like, I can't control what you do with the medication in your system. And so what I started to incorporate with my patients was like going beyond medication. So just how could I support them with getting better with their symptoms? And so what this started to look like was really addressing stress levels, addressing sleep, starting to look at behavioral components. Because one of the big terms, like kind of in the ADHD world, is this term executive function, which is just this long list of mental skills that have to do with our working memory. So our ability to remember things, the ability to be adaptable and flexible with our thinking, and our skills around self-control. Like, can we pause before we say something potentially that'll impact us in the long run? And so executive function skills can be changed. We can learn them. And so even though ADHD is a diagnosis, and I do believe that it's something that most of us will carry traits of for our lives. Like, I don't necessarily think that it's curable. And that's sort of a whole other thing too, of would we want it to be cured? Because I think there's probably some really valuable adaptive reasons that some of us tend to be on the ADHD spectrum. But the executive function skills can be learned. And so I started to coach my clients around specific skills and saying, okay, whether or not we use medication, how can we begin to lean on your strengths? Because most of us, even with ADHD, have certain executive function skills that are stronger and certain that are weaker. And so how can we use our strengths to compensate for our weaknesses? And how can we begin to kind of build and practice ways of working with our like weaker skills?
Wow. Okay. That's fascinating. Could you give us maybe one example of one executive skill that maybe someone lacks as someone that with ADHD, and some of the strategies and treatments? Treatment? Would you say treatment?
Yeah, or just behavioral changes.
Okay,
So
yeah, give us an example.
the executive skill I think most people could relate to, that whether or not you have ADHD, when you look at like questionnaires, what tends to be the weakest executive function skill for almost everybody is task initiation. So the ability to start a task. And procrastination, the harder the task is, and it doesn't necessarily have to be complicated. Like, we can see tremendous difficulty with task initiation with really basic things like cleaning up the kitchen, folding laundry, returning a phone call, listening to your voicemail. Like, there's all sorts of ways task initiation can show up. And so when I'm working with someone around this is certainly the most common issue I think people come to me for. What I would say is, so it does depend on like what the situation is, but the way I look at it is most of us have a feeling of resistance around doing this task. And so if on a scale of 0 to 10, we're having resistance of 10, what I'm looking at is what sort of strategies could we use to bring that resistance from a 10 down to like a 4. I'm not saying you have to love emptying the dishwasher or you have to love listening to your voicemail, but how can we bring that resistance down so that you're able to just get it done? And so one of the simplest things is that people with ADHD often feel very overwhelmed with starting tasks because it can feel indefinite. It can feel intangible. Our sense of time isn't great. And so one of the simplest strategies I'll use is, instead of saying, I want you to do this task to completion, like I want you to clean the kitchen, that could feel so overwhelming. The way I would change that is say, I'm going to set a timer for 10 minutes and I'd love to clean the kitchen for 10 minutes. And when that is done, we're going to walk away.
Love that.
And so it's often just that really simple workaround can make it tangible, where instead of saying, this is so big, it's going to take so long, I don't want to do this, this feels so hard, how can I possibly, it's not logical, but it's very real. And so often just that really simple workaround can change everything for someone. And it's like, oh, I can do 10 minutes. I know how long 10 minutes is. There's a timer going. I can even put music on or listen to a podcast or do something to make it more enjoyable. So that would just be one really simple, but often like life-changing example of how to work with executive function.
Yeah. I love that. And I know you mentioned that procrastination is one of your sort of characteristics of that manifests itself part of your ADHD. Is that something that you use, the timer behavior change, or
I use
what do you do?
timers all the time.
Okay.
I use timers all the time. I use timers. I like to often something called body doubling, which is where you would potentially do a challenging task with somebody else. And it works for different reasons, but for things like household work, I'll often ask my husband to do something with me. And so then together we'll just do the 10-minute rule. I think anything where you can start to make it a game or make it feel more fun. If the house is starting to feel kind of messy, I'll play a little game of just like 20 items where can I just put 20 items away? And so kind of small, simple, tangible strategies are really effective. And I find that the longer I've used these tools, the less the feeling of procrastination comes up, because there just becomes this level of mindful awareness where I could look at a task, and where before the feeling of resistance was so strong, I might have walked away and procrastinated it. Now there's so much more just awareness around it that I can already see it through to the end of I could choose to walk away, and then it's only going to, double down in resistance. I'm going to feel even less desire to do it later and potentially be working on a shorter deadline, or I can choose just to do it now. And so even just with my own experience, I would say, my tendency to procrastinate is really minimal compared to what it used to be, where when I was in my early 20s, I didn't understand why I just couldn't seem to do certain things. And now I'm able to do them with a lot more just efficiency and less drama.
Wow. Something you brought up before, which is an aside to this, is the need for ADHD as a survival mechanism and something that we've adapted. Can you expand on that idea? What are your thoughts?
So it's such an interesting idea, but basically there's a theory that people who we call them neurodivergent. So it's a term for people most often with ADHD or autism spectrum disorders, but for some reason their neurological skill set is a little different than the norm. So diverging from the norm, neurodivergent. That neurodivergence is actually an adaptation. And if you think about more primitive hunter-gatherer societies that we evolved from, a lot of the skills in being neurodivergent could actually be a real benefit. For example, yes, we talk about the negative of being inattentive, but the flip side of that is people who are neurodivergent can hyperfocus. And so it's almost this obsessive ability to focus on something that's important. Most people, whether or not you have ADHD, have probably experienced this. If you've ever lost your passport or lost your wallet, there's this obsessive feeling, I have to find this. And it's like time disappears and you'll tear your house up. You'll do anything you can to find it. That's what hyperfocus can often feel like. It's not always bad. It's also the feeling where you just get so immersed in a book, you forget to get up to eat. It's where you're just so focused. You can see it with kids who play video games, just this hyper focus. But in a hunter-gatherer society, the ability to hyper focus, if you're looking for food and the ability to just have time and space fall away and you're focused on finding food, that's an incredible skill set. A lot of people who are neurodivergent also are more sensitive with their sensory skills. And so that, again, in modern society can feel overwhelming sometimes, but having really fine-tuned sense of hearing, or the ability to just perceive things around you and feeling really sensitive to your environment could potentially tell you, is trouble coming? Is there change in the weather? Do you smell something that seems off, or sensing danger? There can be, the theory is that these are adaptive skills and that being neurodivergent is just a normal part of society. Now, I do think that we're seeing more and more people who are being diagnosed with ADHD and autism, and that is not normal. And I think it probably has a lot to do with modern society, concerns about things like environmental toxins that could be contributing to making epigenetic changes, where if a lot of people have a predisposition to potentially developing ADHD. I think we're seeing more and more people manifesting it than we would have, 30 or 50 years ago.
Wow, that's really fascinating. And I think that presents like a safe space for people that maybe do have ADHD or autism in terms of like leaning into the benefits, the positives, and things that make them different, right? Because oftentimes these groups are marginalized and made to feel like, oh, they're different in a bad way. And you talking about some of these positives and benefits, I think could be like a source of comfort and like empowerment and putting people like in the driver's seat. Like, yeah, I have these tools that can help me and can help others. And so can you expand on any other positives attributes for people that have ADHD? Because even myself, as heading into this discussion, we're going to talk about cravings and hunger, and there's already sort of this like negative connotation around. And so my mind was already like the bad stuff of ADHD, but let's talk about some of the good stuff too.
Sure. So people with ADHD are often incredibly creative. So really like ability to think outside of the box, be really creative. A lot of times people with ADHD thrive under pressure. Like they may have trouble paying attention in that day-to-day really boring math class, but you put them in a crisis, like they're the person you want. Like they can often be very focused. People with ADHD can be really fun. They can be spontaneous, really great sense of humor, often really big heart and very forgiving. Like they can be great friends. They might be friends that you have to just kind of know, like, yeah, they may not always call you back if you call them because they might forget, but like they're loyal and just incredibly big hearted, often very smart. There's no people with ADHD can have the exact same spectrum of intelligence as people without it. So people are not less intelligent or more intelligent, but often very bright. So they're very curious. When they're interested in something, it can be, they want to go like a mile deep on the things they're interested in. So people with ADHD can be very fun to talk to because they have diverse and kind of unique interests. And so, I think we do focus so much on more of like the negative parts. And like, yeah, I'm not here to say that it's easy. Like there certainly are challenges, but I'm really of the belief that you have to play the cards you were given in life. And I can't go through life saying like, this is so unfair that this is what I was dealt. It's more like, these are my cards and how am I going to play them? How am I going to make the best of it? How am I going to work with the parts that feel hard? And still be really committed to enjoying my life.
Yeah, I love that. That's an Instagram post. You need to do an Instagram slide about the positive attributes of those with ADHD. So one of the reasons I wanted you to come on and chat with us is because I started seeing some of your posts relating to ADHD and the impulse to overeat and cravings and how it can impact things like sleep and stress and these things that we talk about heavily at Laura Cavallo Coaching. So why is it that people who have ADHD, and I'm sure it's not everyone, why is there a correlation between people overeating and having cravings and struggling with this sort of element of their nutrition?
Struggling with nutrition, overeating, and binge eating, all very common with ADHD, and it can occur for a lot of different reasons. I mean, one, I've seen different statistics, so I don't have like one perfect statistic to share, but I read one that said of people with binge eating disorder, up to 30% of those people with binge eating also were diagnosed with ADHD, which is like a really strong correlation.
Wow.
And I think that's particularly interesting because there's a lot of people who struggle with occasionally binging or overeating who aren't going to necessarily meet criteria for an eating disorder. And, for people who have that disorder, I always recommend getting a multifaceted approach of support, of like working with a dietitian, working with a therapist, like really getting support. But for people more in the realm that we're talking about, of like lifelong struggles with weight, struggling with overeating, feeling like you're kind of on and off the wagon a lot with, I'm going to eat in a consistent, healthful way that supports my body, I'm going to go totally off the rails. I think that can be really common for people with ADHD. And it happens for a lot of reasons. One is just the impulsiveness that we spoke about before, that a lot of times with ADHD, our minds are moving very quickly. And so when there's a feeling of overwhelm, a feeling of discomfort, or even just a desire for a craving, it can be like going 0 to 100 really fast, and not necessarily taking that time to pause and check in. Am I hungry? Have I eaten enough today? Have I had enough protein? Am I needing something else? Am I stressed? That's one source. People with ADHD also can have difficulty sometimes regulating their appetites. So this could look like under eating during the day. This could be for a lot of reasons. Stimulant medications suppress appetite. A lot of times with ADHD, people are so hyper focused on their work, they undereat or forget to eat. And sometimes eating is just not a priority, or people with ADHD can have a really big struggle kind of keeping a consistent routine in their life. And so for all of those reasons, we're under eating during the day and then can have this huge rebound at night where you feel completely out of control. I'm sure you've had podcasts about this and things like that. Food is also a source of dopamine and stimulation. For all of us, food can feel very pleasurable. And so sometimes you've eaten enough, you didn't undereat, you got what you needed, and nighttime comes around, you start feeling bored, or a little bit of uncomfortable feeling comes up, and we're reaching to food for stimulation. We want something sweet, we want something salty, we want to increase stimulation by food. And so these are all just some examples of why food can be tricky with ADHD.
That's really, really interesting. I like what you talked about with impulse control. And those that have impulse control, could you use some of the same, would that kind of lie in like the executive function like realm of like having some strategies around that?
Yeah, definitely. I think that within executive function, looking at building up stress tolerance, and then there's something called response inhibition. So learning really just to pause. Like, it doesn't mean you always deprive yourself of this urge you have to eat, but really taming impulsiveness by learning to pause just so you can take a minute and slow down, because we're often going way too fast. So learning to pause so that you can own your state. Okay, I'm actually really hungry. Okay, cool. Let's look at what's going on. Have I eaten enough today? Do I need to just get a second helping of dinner? What's going on? Am I bored? Am I feeling really uncomfortable emotions? Am I wanting to eat just because I have something very delicious on hand that is calling my name? But pausing and learning to really slow down. And you can pause in a lot of different ways. Sometimes it's just taking a few mindful deep breaths. With a lot of my clients, I talk about changing your state. So maybe it's just taking a 5 minutes outside, kind of getting out of the kitchen, getting out of your environment, maybe calling a friend, taking a minute, and then really checking in with yourself and taking aligned action. So it's not about eating or not eating, because I don't know what's right or wrong in that situation for each person, but consciously choosing. So you're not just doing something on the automatic.
So something that I want to share that could maybe help you in your practice with your clients is an exercise that I have my clients do when they do feel a craving coming on or a desire to eat. There's an acronym that I created. It's called CHESS, CHESS. And what you can do is just ask yourself, am I craving? Am I having a real craving? Like, do I just want something yummy? Do I want that dopamine hit? Is it nighttime? Do I just want that comfort? H is for hunger. Am I really hungry? When's the last time I ate? Was it more than 3 or 4 hours ago or 5 hours ago? Was it a satisful meal, or did I have just like a protein bar? The third letter is E for exercise. We know that exercise can stimulate hunger and cravings, especially if it's more intense or lasting a little bit longer. E for emotional and stressed, right? Am I feeling stressed? Am I feeling happy? Am I feeling sad? And then the last S is for sleepy. And we know that sleep dysregulation and poor sleep can stimulate things like leptin and ghrelin and increase cravings. And so that's an acronym that we use to help with the impulse, right? The slowing down, asking yourself, CHESS, can also help with the appetite part of it. When's the last time I ate? Have I eaten yet? Maybe it's time for a full meal. And then that dopamine stimulation aspect, okay, yeah, I am craving something. Maybe I'll practice like crave and go, which is one of our craving strategies. So maybe that's a strategy that could help some of your ADHD patients and people listening today. But
I love
yeah,
that.
thank you.
Yeah, I love that. And I also think it's particularly helpful if people go through the whole acronym. It's really forcing that pause of just like taking a beat, and it's compassionate also because it's really about checking in with what you need. Because so often I think when these impulsive cravings come up, we've been so conditioned to feel shame or feel, just complicated emotions around it. And so I love just you kind of like mindfully go through it, ask yourself each question so you can figure out how to meet your needs.
Yes, it gives you the why, right? It gives you like,
Yeah.
why is this happening? But then once you have the why, you feel more empowered, right? Because it's not like, oh, you don't have willpower, oh, you don't have self control, or oh, you're not strong enough, or you're just a bad person, which is all the things I used to think when I was overeating and binging and having some of my moments. And now I'm like, oh no, there's a reason. I'm just really tired today and I'm going to want to eat more. Okay, now I can have strategies around how to handle this and how to manage this. So yeah, to your point, it humanizes you, right? It just like, yes, this is what's happening with my body and it's fine and it's normal and it's natural. So yeah, it's been helpful for our clients. So for those that are struggling with cravings and occasional binges, some of these strategies that you talked about, or causes rather, the impulsiveness, the checking in with appetite, the dopamine hit, these are all more related towards around the nutrition element of it. Is there any other lifestyle factors that you would recommend for someone that is struggling with these and has ADHD symptoms?
So, anyone struggling with overeating, it's never just about food. And so, I think the strategies we talked about nutrition can be really helpful. I would add just about nutrition that I think making sure that we're getting both the macro and micronutrients that we need is really important. A lot of times people with ADHD struggle with the rhythm of eating. And so I often will challenge my clients to say, I really want you to eat 3 times a day.
Mm.
It doesn't have to be 3 huge meals, but starting to find a rhythm can actually bring a lot of balance and you'll feel more focused and more energetic. Usually I focus on can we get enough protein and fiber? I love the way you build your satisful meals,
Mm-hmm.
Laura. I think that is like a really helpful way to structure meals. But for my clients, I'm just like trying to make sure, can we get enough protein? Can we get enough fiber? Because I think that can help a lot with feeling satisfied, with feeling full. And with ADHD, there's a lot of convenience that happens. And so it's really easy to just walk through the kitchen and grab half a chocolate bar and be like, well, I ate, but not necessarily fueling your body with what you need. So fueling your body in an appropriate way, I think, is essential. And it can make a really big difference in the ability to focus. It's like making sure your gas tank is full. And then it also can prevent like running on adrenaline. Like people with ADHD can often be really prone to excess caffeine use. I'm not against caffeine, but I think for a lot of people, if you're drinking a pot of coffee instead of having breakfast, that can really just set you up for feeling off all day long. Like it really amps up your stress hormones, it suppresses your hunger, and it's just going to like throw you off for the day. And so, I really will say like trying to create balanced, structured meals as much as possible. And something I do with my clients is like, yes, cooking can often be a pretty big barrier for people with ADHD. And so finding really easy, efficient ways to fuel yourself, kind of combining home cooked with convenience foods. Like we might use more frozen or canned foods if we want to minimize food waste, but make sure you're still getting fiber and fruits and vegetables. So, really working with someone where they are in order to find ways to fuel your body. But then also looking at sleep, because there's huge correlations between sleep issues and ADHD. It's bidirectional in the sense that ADHD can make your sleep worse. People are more prone to like the whole spectrum of sleep disorders, including just insomnia, restless sleep, nightmares, sleep apnea. And then poor sleep can also make ADHD symptoms worse. So I always want to look at addressing sleep and making sure that there's no potential like airway issue. Sleep apnea can make ADHD significantly worse. So really doing an evaluation there to make sure sleep is okay and addressing any sleep issues that are present. And then stress, which I know stress often sounds like this sort of catch-all where we say, oh, like all chronic diseases are caused by stress. And it's like, what does that even mean? But, really just acknowledging how untreated ADHD can increase stress, and just stress in and of itself in our life can increase ADHD symptoms. And so that's, I think, a lot of times where coaching, like ADHD specific coaching or therapy, can be really helpful in finding ways to reduce stress levels, because stress is going to increase inflammation. It's going to increase anxiety symptoms. It's going to increase ADHD symptoms. It can make sleep worse, and it's going to influence our appetite and craving. So it really can have profound downstream effects.
Wow, that's crazy how it's like cause and effect, right? So like sleep deprivation and stress, increased stress will then cause more ADHD, but then the ADHD will also cause both of those other things to be impacted. Is the stress ADHD correlation and the sleep one, is it because, well, let's talk about sleep rather. When someone is sleep deprived, things like cortisol and adrenaline are increasing, and then that will then increase things like impulse and thyroid burning out. And can you expand on that a little bit?
Potentially. So, I mean, yes, with sleep deprivation, we're going to have more stress hormones like the cortisol and adrenaline. I think also we just have certain deficits when we're sleep deprived. We're going to have less good executive function. And that's going to be true across the board. Right. People with ADHD are just more sensitive to it. And a lot of times, I think one of the biggest issues with sleep deprivation is most of us are not aware that we are impaired when we haven't slept well. Most of us would say, oh, I'm really tired, but I'm still functioning well. When in reality, that's not necessarily the case. Like, we're probably performing less well, but there's a lot of different reasons for why that is. But certainly, it increases cortisol and adrenaline. And then I think you mentioned also it can drastically influence our appetite and an ability to feel satisfied. And so a lot of times with sleep deprivation, that can be a major driver of cravings.
Yeah. I feel like we could have a whole separate episode on stress and sleep and strategies around that. It's so involved, I feel like, in the sense that there's so many things that we can do to help, one, improve sleep and decrease stress from specifically sleep, like your sleep routine, all the way to how you're setting up your bedroom, to, what you're doing during the day to prepare for sleep, right? And I have various episodes on this, and I'm sure Laura's addressed this as well on her Instagram and in her newsletter. So we're not going to dive too deep into these two because we could talk for another hour about them. And so in the way of cravings and overeating, do you have any other recommendations or suggestions for people with ADHD in the way of setting up their diet, their nutrition? You talked about regular meal timing, prioritizing protein and fiber, setting alarms if you need to, making sure that you're being present when you're eating and you're not just, shoving food down your throat, being distracted. Any other recommendations that you would make?
I would just remember that everybody has a really limited amount of willpower. And yet most of us try to set up life changes relying on willpower. And instead, what I would invite listeners to think about is, how could I use a little bit of willpower? And when I think of like quantifying it, like if I had 1 or 2 hours a week to have willpower, how could I use those to set up my environment in a way that I will reach the goals that I want to reach? And so often I, talk to my clients, and it's like, if I had like a slice of chocolate cake sitting on my desk and I had it here 8 hours a day, and I was like, I am not going to eat this cake. Like, how long are any of us going to last? Because we all have like, it totally makes sense that we have biological drives for eating sweet, fatty things. And trying to rely on willpower is just a losing game. And it really is for everybody. And so what I would say is, can we use what limited willpower we have to set up our day and our week for how we want to feel. And so what I would say is, like, I personally use my limited willpower to go to the grocery store, or actually grocery delivery. What me and my husband continually find is that when we get groceries delivered, even though there's a grocery fee, we save so much money on not impulse shopping, and we have less food waste. There's actually, like, both economic and environmental reasons to potentially do that. So, if you have that in your area, considering grocery delivery, because then we're really thoughtful with what we're getting, and then using it to do really basic food prep. And now I'm not talking about making casseroles and soups. Like, sometimes I do that. But when I talk about food prep, it's doing something like, I'm going to batch cook some rice so it's ready all week long. And I might make something with protein in it that could be mixed and matched. And then I have some sauces that are pre-bought or pre-made. And then when I need to make a meal, I could just chop up some vegetables or throw a handful of arugula or green, so that I can pretty quickly make satisfying meals without needing a lot of willpower. And so I think that, for anyone who's struggling, it's like having foods around that you want to eat, not that you're going to be trying not to eat. Or if you want to have those more like craving indulgent things, get it in the portion that you're actually going to eat it. So that way you just don't have temptation. It's there, you can eat it, you can enjoy it, and then you can move on.
Yeah, we call that small sweets at
Yes.
Laura Cavallo Coaching. So buying like little peanut butter cups and, putting them in the freezer, or, portioning out your ice cream in a little bowl away from, and then eating it away from the fridge and waiting that 20 minutes before you give yourself a second serving, so that you're resisting that impulse, you're indulging in that sweet food, that salty food, whatever it might be. And we don't fill up on those foods, right? Those foods are more just to give us that craving that we want, that fun food we want. And oftentimes we feel pretty satisfied from that. So I love that you brought up environment. I love it. I really appreciate that so much, because oftentimes we just think like, well, just tell me what to do with my nutrition. Just tell me what to do with my exercise and I'm going to do it. Right. And it's like, but your life is completely different than my life. Right. So we need to make this work for you. Like you said, I'm going to meet you where you are and then take you one step at a time. So identifying those areas of resistance. So, maybe for you guys, it was, food shopping and having some easy, accessible things that you can eat. And so at your household, you've done the food delivery, you've meal prepped one thing, maybe it's some ground turkey and some rice, and you've just found ways to make things more seamless for yourself. So for anyone that's listening, and of course I have like landscapers in my background doing stuff, so sorry for the background noise. So if you are listening and you have ADHD, maybe a good takeaway for today is to find one thing that you have some resistance with, and either set up a timer to give yourself that 10 minutes of doing something, make it into a game like Laura was saying that she does sometimes, or find a way to set up your environment to create a little bit less resistance around your nutrition and your meal prep, and helping you get consistent with your meals and eating more satisful. And let us know like what you're gonna do, and pop into our DMs and let us know what you thought about today's conversation and some of these strategies. Laura, I loved chatting with you. I'm probably going to invite you back again, because I love talking with you and everything that you represent and stand for and coach. But before we head out, before we leave, is there anything else that you want to share? I mean, we've covered so much, but any final thoughts around ADHD in general that could help our listeners?
I would just leave the listeners with, I know when you're first diagnosed with ADHD or suspecting that you have it, there's often this emotional period of feeling stressed or questioning, and life feels really hard for a short period of time. And I really just want to offer hope in that it gets better. There are tools, there are strategies. It's not going to be like this forever. It does get easier, and most people need some support. So don't hesitate reaching out for support, whether it's for coaching, for therapy, finding a doctor in your area that is helpful. I do currently still take one-on-ones at the time we're recording this. I do health coaching, medical care for people in certain states, and I do ADHD coaching. So like that's an opportunity, or you can find someone that's local to you, and just keep staying the course, because it does get better, even though having ADHD can feel incredibly stressful at times.
Thank you so much. I think that was a great way to end it. And you're right that people who first get a diagnosis, really with anything, it can feel really overwhelming and scary. And Laura's been a great resource for me as I've helped my clients. And so we're going to link her Instagram below and any other resources that she wants to share and how to connect with her if you do want to do any one-on-one coaching or get any additional support from her. Thank you so much for being on, Laura, and I can't wait for our next discussion.
Thank you so much for having me. I'd love to come back anytime.
Thank you. I'll talk to you soon.